responsible for any claims or representations made during this program.
The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering dental implants. My first guest is an expert on the topic, Dr. Kravitz. Dr. Kravitz, welcome to the program.
And thank you very much, Randy.
So let's begin with your practice before we get into today's topic, because I guess you do more than just dental implants. I mean, you do traditional, everyday dentistry, cosmetic dentistry.
Yeah, we have many patients that come to us from all over the country, and they see us from a range of just cleanings to ceramic veneers. Say they don't like their smile.
All right.
Say some people, they have some cracked teeth and they need to have them removed.
Okay.
People that are missing teeth, people that have dentures, people that need bridge work. Our practice is about anybody that wants to improve their smile and keep it healthy for life.
Now, we've talked on the phone, and you say that that you feel like you have a special sensitivity to people that their teeth may be holding them back. They look at it as a disability because you're a stutterer. Yes. Growing up.
Yes.
And you elaborate on that.
It started back in 1967, when my parents helped bring me into the world, and they realized that I wasn't like other people. They realized that I had this speech problem called stuttering.
Okay.
And so I've been dealing with this affliction in my whole life.
Okay.
But I've conquered it for the most part, because I'm here with you today.
All right.
And what that means to a patient is that I understand when someone has a communication problem. Say the person who is listening to them. When they see someone stutter, they either say it for them, they will go ahead and they'll look away.
Okay.
Or they will think that you're not as competent, or they'll just avoid you because they're just uncomfortable. Well, the same thing goes for people that are missing teeth, because it creates a communication problem for someone who is wearing like a denture where the teeth are clacking around.
Like a loose-fitting denture.
Sure, like a loose-fitting denture. And so I understand that those people that are missing teeth, because in fact, from the U.S. Surgeon General's report from the year 2000, showed that in this country, that if you're of the age of 50 and older, that on the average you are missing about 12 or more teeth. That's a lot of teeth.
Yeah, wow.
And then about 25% of those people have a fear of intimacy, a fear of leaving the house.
Is that right? Like kissing, things like that?
Yes,
obviously.
yes. And so I can relate to that because of my stuttering problem. So I have an empathetic need to help that segment of the population.
Now, you do a procedure, you call it 3-minute implants. You could actually do implants in 3 minutes.
Yes, yes.
Not a gimmick. I mean, that's...
It's not a gimmick, and I know it sounds too good to be true.
Okay.
But we actually have the technique down where it takes less than 3 minutes per implant. And because we know that patients don't want to sit in the chair. We know that they don't want to be there for hours.
Sounds very painful, though, by the way, getting a dental implant. Is that something the patients complain about? Is that...
Yeah, that's what I hear all the time from patients, that they talk to their friends and neighbors saying how uncomfortable it was for them. And after placing thousands of implants, I learned what way not to do it, such as we don't use a scalpel. We don't place stitches, so when you leave our office, there's no bleeding. Almost all the pain associated with dental implant surgery is from cutting the gum tissue. And we don't do that.
You don't do that? Interesting.
Yeah.
Okay, we interview medical doctors on the show from all over the country, and more of them are saying that, that periodontitis or periodontal disease affects the rest of the body, which is a separate topic. The denture, we've talked about this. You say they benefit the most with dental implants. Let's talk about that.
Yeah, the people that are wearing dentures. Say we look at this right here.
All right.
Say we have some dentures here. And this is how the typical patient will present to me, Randy. They have an upper denture, they have a lower denture, and they're missing basically all of their teeth. That's like having no arms and no legs and no head. And that's what it's really like. So it's really tough for those people.
I mean, do they tell you that?
Oh, yeah.
But on the consult, what do they say? What does a denture wearer say to you? Because I know a few denture wearers, and they don't complain about their teeth.
Yeah, well, I find that a lot of denture wearers don't go into the dentist because they're worried about what someone's going to say, or they're also worried about that they can't be helped, that there is no help for them, that they're not a candidate for implants. Or say they heard that it was so hard before, like in the early 90s, there were a lot of failures, and so they heard those stories that are no longer appropriate today. And So they are really suffering because these upper teeth, I call them clunkers, they just clunk around.
You call it implants for clunkers. What is that? What is that?
Yeah, so the Implants for Clunkers program is where you come into the office and you have clunkers like this.
The dentures, okay.
The dentures like where they don't fit, they're miserable, you have sore spots, you're using a denture adhesive, and you leave the office with implant-supported teeth that you can bite into food, that you can enjoy a very nice a lifestyle and improve your overall self-confidence by leaving with teeth that are secure, that feel good, that don't hurt, and they look attractive and beautiful.
So let me get this straight, though. You say, for the typical denture wearer, 4 dental implants can give them something fixed in their mouth that they don't have to take in and out. Is that right?
Right. The minimum is 4 to go to a fixed bridge, which are teeth that don't come in and out. You can have up to 12 to 14, but not everybody needs that. Not everybody needs more than 4. So what we're saying here is that in as little as 4 implants that you can leave with teeth that you can bite into, say, a corn on the cob, say a sandwich.
So they could eat steak, things like that.
They can chew steak.
Okay, now,
and Randy, and by the way, this changes their life. And the reason why I know that is because we follow up our cases. The cases that we've done for the people that come back, they have a very high success rate. They have a very high success rate because they follow it up. Because once you get this done, you need to keep it clean. You need to brush your teeth. You also need to keep it healthy.
3-minute implant. Okay, 2. And by the way, is that true also? 2 dental implants could give them something snap in, snap out.
Yes. So Randy, so say you came into my office and say that you were wearing dentures.
Okay.
And say that you liked the way that they looked, but you didn't like the way that they fit because they were moving around. They were clunking around. And so we can place 2 implants and secure your dentures in the same day. The dentures could be hooked up to the implants, and you don't even have to redo your dentures.
So using your same denture, what you just put fastens in there of some sort?
Yeah, like buttons.
Going in and out.
Right, it can snap right into the implants with no pain.
The glue that they're
using? Huge difference. You want me to show you what it is?
Yeah, show me the glue. You got the glue.
So say the typical...
And every denture wearer must know this scenario.
Yes, everybody that's watching this that has a denture knows what this is. But for those that don't, say you have like a family member, say it's one of your grandparents or one of your parents that have this. And so this goop is flowing over, it flows over the edge, and then you stick this in your mouth, Randy.
All right.
And pull it in and out.
Okay.
I mean, that is a goop and gunk. Now, yes, this will serve its need. This has a need, but implants are far superior to using this denture adhesive. In fact, I calculated out the cost. If you bought denture adhesive every week for 10 years, that would cost more than the fee for 2 dental implants.
Is that right?
Yeah.
You shared with me an insight that the way you do it at your office is not how it's normally done. That means you do the surgery, you also put the tooth on it, and you do the imaging right there.
Right.
It's not normally done that way.
No, it's not.
Elaborate
on
that.
So typically, a patient sees a dentist, and the dentist refers the patient out to some type of specialist to see if they're a candidate for dental implants.
Okay.
And so then that surgeon will take some x-rays, and then they'll have to consult with another dentist that makes the teeth. And so then they have to go to a third office.
It's really done that way, is that right?
Yeah.
Okay.
So then they'll have to go to a third office to go and have the teeth fitted, and after a bunch of appointments, then they'll have to meet with the laboratory to go ahead and match the color. What you're really doing is to have teeth. You want the teeth to look good, to look attractive, to actually blend in with your mouth, so it doesn't look like you have an implant tooth.
Okay.
But in our office, we have a 3-dimensional color CT scan, so we take the scan right there. So I'm cross-trained in surgery and teeth, so I place the implants. We have a team of people that help us. Plus, we have an in-house laboratory, so we have an expert artisan who's really good at picking out the color. Could you ever work with someone that's like colorblind, where it doesn't
Well, I
match?
feel like I could spot a denture though. 10 yards away.
Yeah, you can't spot my dentures.
Is that right?
Yeah, my
Okay.
dentures are custom tinted. They look like real teeth. In fact, I'll show you some pictures here in a little bit.
Okay. So aside from convenience, doing it all under one roof, is it better for the patient?
Yes, because I have control over all of the variables from beginning to end.
Okay.
I am beginning with the end in mind. And what does that mean? That means, it's like building a house without a blueprint. The walls would have to be moved all the time. That's very expensive change orders.
Okay.
So by having a 3-dimensional scan allows us to know where the walls need to
But
be.
anticipate this interview, like my mother, okay? She's 73 years old. She's been in dentures 25 years. And she says,